I am this community Colombia live from the market on 25th Street, located 1330 North 25th Street. I'm inside the Hope Pharmacy. I am really inside of the Hope Pharmacy with Dr. Chantel Brown. How are you?
I'm doing well, and yourself?
I'm doing okay. I've been having this question and forever. So usually when I'm walking in the market, you're always busy. Someone's at the counter,
Yes.
picking up, dropping off,
That's a good
consultation.
thing. That's a good
Great thing. But I wanted to talk to you about, since we have a heroin opiate crisis all across the nation and in the Commonwealth of Virginia. And I know of some people who've had addictive behaviors,
Yes.
who are in recovery now, and they have pain, deep pain, and they don't want to take pain medication for fear that it's an opioid. So today we're going to talk about painkillers versus opioid.
Yes.
Help me.
Well, both of them are painkillers.
Okay.
And so it's just the effect of how it makes it, the addictive effect on the patient. And so the opioids, they have a tendency to cause addiction. And so if they're not monitored properly, patients will and can develop an addiction towards them. And so that's the problem. The problem has been with the amount that patients are being given, that the doctors are dispensing and prescribing, and it's become a really big crisis. And so now the CDC has come down with different guidelines on ways in which they feel as though would help with the epidemic so that more patients will not become addictive and so or addicted. What they're doing, they're limiting the amount that the patient is able to get. And so if it's 7 tablets or 7-day supply, that's what we're looking towards versus a whole month. There's really no reason for a patient to be on any type of opioid for over 7 days. It should relieve the pain with proper treatment. If it's not, then that's when we need to really come up with a pain solution and get into some type of rehab. They have the pain clinics just to make sure that you're being monitored properly. It's nothing wrong with being on an opioid. If you need it, you need it. It's just when you need it all the time and you're not getting the actual benefit, you're getting the high from it.
So what about when you talk about the painkiller? Okay, you have this excruciating pain,
Yes.
and you need to take this painkiller.
Yes.
Let's talk about the traditional painkillers without the opioid and the ingredients in there. How long does it take to kick in?
Well, it just depends, and I think that's the biggest thing. The opioids, they do relieve pain a lot sooner, a lot faster.
Sooner.
Sooner. And
Later. Dr. Brown.
Yes, ma'am.
All right. Painkillers versus opioid. How long does it take for the traditional painkillers to kick in?
Well, your Motrin and Aleve, they work a little bit faster. They can work within an hour or two.
Late.
And sometimes some of the opioids can work within 30 minutes. It just all depends
Sooner.
on how they're metabolized. Sooner, or late. And so what I try to recommend for patients, if they're given an opioid and they can, as long as they can take Motrin, they can take Tylenol, take that for your regular schedule, mild pain. But when it's excruciating, then you want to take your opioid. So that will help eliminate some of the need to have it all the time.
Yes,
I think that'll be a good
Brown is right here at the Hope Pharmacy. We're at the market on 25th, located 1330 North 25th Street. We got a community conversation coming up. Talk to her. We're market on a mission.